Good afternoon. I'm Tom Hudacko from the Utah Department of Health. Welcome to today's COVID-19 media briefing. Before we get started, I wanted to remind everybody that beginning this week, these briefings will be held on Monday, Wednesday, and Friday, still at 1:30, still in the Capitol presentation room, and still over Zoom like we've been doing. We will have one speaker today. That will be Dr. Angela Dunn. Dr. Dunn will provide a situational update.
Okay, good afternoon. We now have 5,317 cases of COVID-19 identified in Utah. That's an increase of 142 from yesterday and just a 2.7% growth increase. We've tested over 124,000 Utahns for COVID, an increase of 2,559 from yesterday, and we still have a 4.2% growth or positive rate for testing. We do have 5 new hospitalizations since yesterday for a total of 441 hospitalizations since the beginning of this outbreak, and we don't have any new deaths to report. So one of the important things we track with our data is where positive cases were likely exposed to the virus. And what we found is that people with unknown exposure, or what we call community spread cases, is dropping. Only 11% of cases are considered to be community spread. 60% were exposed by someone in their household, and 25% were exposed to someone they know outside of their household, and only 4% were exposed at their workplace. Another issue we're actively tracking is an outbreak in San Juan Health District associated with the Navajo Nation. They have had a total of 116 cases from the beginning of this outbreak, and over half occurred last week. Our mobile testing team with the Utah Public Health Laboratory has been out several times in the past couple weeks testing all of the community members. And the Utah Department of Health has been providing guidance on contact tracing, quarantine, and isolation as well. With that, I'll take some questions.
Thank you, Dr. Dunn. Here in southern Utah over the weekend, the state parks were open, and there was a big influx of folks, especially at Gunlock State Park. And a lot of people commented about the fact they saw out-of-state plates, almost 90%, Nevada, California. And the question is that going to be an issue here as far as people coming from states where still have much more strict restrictions being an open sign on Utah?
Sure. So I think what you're bringing up is the idea that social distancing is still very important. You know, no matter where we come into contact with someone or where that person's from, maintaining social distance is important to prevent the spread of COVID-19. So as we kind of roll from red to orange and things start opening up a little bit more, we're still going to rely on people being smart in terms of their exposures and where they go and protecting themselves and vulnerable friends and family members from being exposed to COVID-19. So that's definitely something we're going to have to watch as these restrictions start becoming looser.
And to follow up real quick, as far as people from out of state, I know we've had the questionnaire that people fill out when they come in, and it's voluntary, obviously. But are there any other concerns that people from out of state can bring the virus here without the care for, your neighbors, so to speak, and spread the virus locally?
Sure. I mean, I think across the U.S. right now, there's community-wide transmission of COVID-19. So certainly being from a hotspot area like New York City would put one at risk for spreading it more likely. But our surrounding states are, similar to what we're dealing with here. And, we don't have any plans right now to prevent tourists from out of state from coming into Utah. But that is something we can keep a close eye on as restrictions start loosening up.
Hi, Dr. Doug. Carter Williams with KSL.com. I have a couple questions that are a little similar. Last week, you said that the state was working on putting together specific criteria that would trigger a return to red.
Sure.
Have those been created yet? And if so, will they be made public? And then also, at what point would Utah consider testing everyone for COVID-19 regardless of symptoms?
Sure. So we're finalizing those metrics tomorrow. I can tell you they're based on a few principles, including watching our healthcare capacity. We want to make sure that we're never going to come anywhere near overwhelming our healthcare systems. We also want to make sure that our case growth rate is decreasing. Right now, we're at a great plateau, and we want to see that going down. And of course, we want to maintain testing and contact tracing capacity, because without testing and contact tracing, we're not going to be able to prevent the spread of COVID-19, no matter how small. So those specific metrics will be finalized tomorrow. I'm unsure if they're going to be public or not, but if they are, we'll certainly let you know. What was your other question?
Yeah, at what point would Utah consider just testing everyone for
Sure.
COVID-19 regardless of symptoms?
Yeah, so asymptomatic testing definitely has a part in controlling this pandemic. We're already rolling it out in a very targeted way so that we improve the assurance of that test result and that we know what to do with it as public health. And so we are targeting specific high-risk populations and those more likely to have been exposed to COVID-19 and testing them regardless of symptoms. Once we get that established, we'll look at the data and determine if it's accurate enough to roll out statewide. But at this point, we're really focusing on a targeted asymptomatic testing strategy.
All right, thank you.
Mm-hmm.
Hi, Dr. Dunn. This is Jacob Kloppenstein, also from KSL.com. I wanted to ask a little more about the outbreak in San Juan County. Do you have any more details about that, or is there any indication of how it started or anything like that? And
Sure.
Then I think you mentioned mobile health units have been sent down there. Does that basically mean the strike teams that you've mentioned, or will a strike team be sent down there?
Sure. So most of the cases we're finding in San Juan right now are associated with the Navajo Nation, which of course is a sovereign nation. So we're supplying support as requested. And right now they're really in need of just testing capacity. And so our mobile teams down there are 100% focused on mobile testing and not necessarily the complete picture of the strike teams. We are providing guidance and meet with them regularly to talk about contact tracing and other elements of response. But right now, we're just focusing on the testing on the ground. And in terms of what started it, we don't have any indications now. We just know that they've seen a spike in cases over the recent weeks.
Thank you.
Hi, Dr. Dunn. This is Michael Orton with the Capitol Press Corps and Capitol News Service. You have a COVID-19 task force meeting scheduled later this afternoon. I'm wondering, beyond anything that you've already shared with us in terms of statistics, what else you might be able to reveal about your part of that agenda. And the other question I have is that you said you weren't sure if the criteria for returning back to red designation was going to be made public, and I'd like to know, if not, why not?
Sure. So for all of the Lieutenant Governor's COVID task force meetings, I supply the data in the epi side. So I let the group of stakeholders know what we've seen, what we've been seeing, and what's going on, and provide my interpretation, much like I do today. And then they have the opportunity to ask questions as it pertains to them. So for the rest of the agenda, I'm not sure what else is on that for today. And in terms of the metrics, I haven't been in the discussions over whether or not to make them public or not. My guess is they're going to be made public. I just don't know for sure. So we'll make sure we get back to you on that.
Very well, thank you.
Yeah, can you hear me?
Yes.
Oh, yeah. Hello, Dr. Dunn. It's actually Amy Donaldson from the Deseret News, but you know, that married name on the Google. I had a couple questions about the San Juan issue. You said that something about the spike. I wondered if that is just due to testing, if you're just revealing cases that already existed, or do you believe that there's a spike? So what exactly is that testing, the testing that was done 2 weeks ago and the testing that was done last week? What is that telling you about that situation, and
Sure.
in what way are you monitoring it?
Mhm.
And then secondly, I just wondered if there's any talk on the coronavirus task force to try buying that remdesivir,
Sure.
however you say it,
Yeah,
the new
remdesivir.
drug that is
Yep.
offered some promising results.
Sure. So in terms of the testing that's being done through the mobile units in Navajo Nation and other places, it tells us who's actively infected with the virus. So that spike in cases is a true spike in cases. It is true that they had limited testing prior to our mobile units going down there. That is why we went down there. So there are likely cases that we missed weeks prior leading to this spike we have now. But the spike is real, it's active cases. And as I kind of mentioned before, we're working with the healthcare providers in Navajo Nation to ensure that they have all the capacity they need to control it, which includes testing. And that's what we're doing on the ground for them, is actually the testing. In terms of remdesivir, I don't know of any conversations at the legislative level or at the governor's office level about purchasing it. I know that there are some promising results about shortening the course of disease, and I think there are going to be many more studies going on, both in Utah and nationally, that will help us to better understand what drugs will be important in treatment for COVID-19.
Yeah, Dr. Dunn, Ben Winslow with Fox 13. I just was curious if you have gotten any kind of a situational report over the weekend about how people handled the relaxed guidelines, and if, things were looking promising, or are we cruising at going back to red risk level?
Sure. So, me personally, I don't know. I wasn't really out and about over the weekend. But, we have definitely seen and heard reports from others about, there's some clusters of people not wearing masks, and then, people visiting state parks maybe in more crowded situations than we would like. But, that impact of us going from red to orange, we won't really understand the impact on COVID cases for at least another week or two. So we'll have to watch that data carefully to understand the exact impact that it will have on the spread of COVID here in Utah.
Hi, Dr. Dunn. Haley Hendricks with ABC4 here. Kind of following up with Ben's question about things reopening in the state. What are your concerns about us reopening the state? And do you expect to see a surge in cases in coming weeks?
Sure. That is my concern. My concern with reopening, of course, is going to be that we see a surge in cases. And we're doing everything we can to prevent that with the guidelines we've set forth, with having high capacity for testing and contact tracing. All those things are designed to prevent that surge in cases. But, as a public health official, our concern is always going to be seeing more cases than we should. So we're going to be looking out for that. But we know we have to balance the policies of what public health recommends with what other experts recommend as well, because this public health pandemic certainly crosses sectors. And so the governor has to take all those policy recommendations into consideration before setting his ultimate policy. So in public health, we'll just stand ready with our testing and contact tracing and continue to prevent spread, especially among our vulnerable populations.
Thank you. So do you expect to see a surge then in coming weeks?
No, I certainly hope not. We know that COVID-19 is spread by direct contact from a sick person to someone who is susceptible. So decreasing social distancing always has a risk for increasing the number of cases. But I'm hopeful that the policy set in place to slowly roll this out, in addition to contact tracing and testing, will allow us to stay the course and see a drop in cases in the coming weeks.
And do you have any recommendations, again, that we can remind the public about?
I think the main thing here is to still apply social distancing measures when you can. It's really important that we follow those guidelines in terms of wearing a mask when social distancing is not possible, and definitely protecting those at high risk for severe disease. So over 65, others with medical conditions. It's going to be really important for those populations to specifically stay home, and for us who can go out and about and aren't at risk to help them out getting their needs met as well.
Thank you so much.
Okay. Thank you guys so much. Have a good afternoon.